Hello friends, welcome to Srinetral. In this very interesting video, we will see how to dissect an anterior stromal scar which can be easily diagnosed with a readily available machine in most of the clinics nowadays, that is anterior segment OCT, which has a very crucial role in diagnosing these cases. This particular patient is a 36-year-old female who had a trauma in her childhood and was having a vision of 636 following it since last so many years. To peel off the epithelium easily, we are applying a alcohol swab to the epithelium which loosens this epithelium to make it easy to peel off. Once the epithelium is loose, it can be taken off with the help of blunt instrument like iris repositor or epithelial debrider. Once the epithelium is off, the surface is dried to follow the dissection of a scar. The scar should not come into piecemeal, so we have to be very cautious while dissecting this scar. Try to use a cotton tip to dissect off the scar as shown here. If it is working, then it is very good. The likely chances that remaining scar is there in the residual bed is less if you use a cotton tip. Do not use the crescent directly and slowly peel off the scar. Here I am using a tooth forceps to peel it off. You can use a slightly broad based forceps so that the scar should come in toto and not in piecemeal, as residual remnants of the scar may cause abrasions later date and diminution of vision thereby. If you have some remnants remaining, then you can use a diamond burr to smoothen the surface following. Here that was not the case, so diamond burr was not utilized. Once the scar is dissected and taken off, now we have to take care to prevent the recurrence of the same scar again. To prevent the recurrence of the scar in future, it is crucial to use mitomycin in such cases. I am using a freshly prepared mitomycin on a cotton swab for 15 to 20 seconds once the scar is dissected. Carefully wash off the mitomycin with 20 to 30 ml of saline for next 2 to 3 minutes. In this case, patient's vision improved to 6/6 parts with 0.75 cylinder in the post-op period. So, whenever you are seeing a scar which is anteriorly located in your clinic, get OCT done and get it removed. Do subscribe for more such exciting videos to a YouTube channel, Dr. Pankaj Lande.